To start off with our update today, we have 7 new cases in British Columbia to tell you about, which brings our total to 39. To start off with, we have 2 new cases associated with the Lynn Valley Care Centre. Both of these cases are healthcare workers who were working in the area of the outbreak in Lynn Valley. They're both in isolation at home. There's been a number of testing being done on people with symptoms, and there are no new cases in residents of the Lynn Valley Care Centre, so that's good news. The initial person who was identified in the community as a care worker at the Lynn Valley Care Centre has been admitted to hospital overnight. She's in stable condition and is being monitored and cared for. I just want to talk about the ongoing investigation at Lynn Valley. I mean, obviously that's very much a concern for us, and everybody in the facility is being monitored and assessed, and those who have symptoms are being tested for COVID-19. And I just want to reiterate that because I think there was some confusion with some people in how I said this before, but there is no value to doing testing for people who don't have symptoms after an exposure. So they are monitored for their health, and if any symptoms arise, then they're tested. So the investigation continues on trying to determine exactly how this virus got into the population at Lynn Valley, both the healthcare workers, the residents and families there. And that is something that will take some days for us to get down to the bottom of. 3 of the cases that we've detected today are travel related. One of them is a woman in her 60s who was on a tour in Egypt, and we think this is interesting. Another close contact of hers who was also on this tour is being tested and may well test positive as their symptoms just developed, so that's would not be surprising. We have heard from colleagues across the country, and particularly in Ontario to start with, that there's a number of cases in Ontario and Quebec that have been related to tours in Egypt, and so we are working with our federal counterparts to see if these tours are related. We know that there has been cases in Egypt on some tours with foreigners who are there as tourists, including some on Nile cruises, and my understanding is that part of the tour that these 2 people were on included a cruise on the Nile. So that's something that we'll be following up on in the coming days. Another travel-related case is a man in his 40s who returned from travel to Germany, and so the investigation on exactly where he was and what happened there is ongoing. He is in isolation at home. And finally, we have another travel related to the Grand Princess cruise, the one that was prior to the one that was just repatriated today, the one from the 11th to the 21st of February. And this is a man in his 90s who was on that cruise, who has tested positive and is in isolation at home. We have 2 additional cases, all of the previous 5 that I've just mentioned are in the Vancouver Coastal Health Region. We have 2 additional cases in the Fraser Health Region that have just come to light today, recently diagnosed, and we're actively investigating those ones. One is a man in his 90s. We're not clear yet where his contact might have been, so that investigation is ongoing, and he is currently in hospital in Fraser Health in isolation. The other is a man in his 40s, again a community case that we do not yet know the link, and he is in isolation at home. It is, as I mentioned before, it is these community cases that give us some degree of concern and grief, but being able to detect them is really important, because as soon as we can detect them, we can start that detailed investigation to find out where they might have come in contact, and it helps us uncover where other chains of transmission are in our community. And as you will recall, the case we're calling case 21 of the healthcare worker who worked at the Lynn Valley Care Centre, it was by understanding where she was and going through that detailed detective process that we were able to uncover the outbreak at Lynn Valley early enough that it appears still a small number of residents are affected. So we know that this is another area that we need to focus our attention, and there's a lot of work going on right now, even as we speak, in the Fraser Health region with my colleagues in public health to do those detailed investigations around these two new cases, and we're actively hunting for the potential source for these cases so that we can, the nice part of that we do is now these people are in isolation. We know they're close contacts. We can stop those chains of transmission so they don't continue in our communities. On a positive note, we've also had some people released from hospital, including, really pleased to say, the 80-year-old woman who's admitted to ICU at VGH, now released from hospital, is occurring at home. And one of the passengers of the Grand Princess, there were two that we mentioned, both in their 60s, and the male in his 60s has been released from hospital as well, in his but is in stable condition and doing well. The other sort of major thing that's happened, I guess, globally that affects us these days, we've had our first, yesterday we reported our first imported case from Italy, and as you are no doubt aware, the situation in Italy has scaled up dramatically in the last few days, and we know that there's cancellation of flights and restriction of movements for the entire country now. And in addition, we'll be asking anybody who comes, who's a returning traveler to Canada and to BC from Italy, to self-isolate for 14 days after their return. So that's the same provisions that we have in place for people coming here from Iran and from people from Hubei province originally, although the risk in Hubei province, as we know, has decreased dramatically. As well, our pandemic preparedness continues, and we'll be talking, the minister will be talking a bit more about that. We're wrapping up testing and testing ability in our community. We've done almost as many tests in the last 4 days as we did in the first 2 weeks of monitoring for this, or in the last 2 weeks of monitoring for this, for COVID-19, and that includes our community surveillance. And it's sometimes a challenge to know if we're doing enough, and the fact that we are picking up some community cases is both concerning and reassuring. Because we are doing so much testing, we know that we are going to pick up sporadic cases, but it also gives us a sense that there's not a lot of them out there that we're missing. But we do need to ramp up our testing capability, both in the laboratories, and we talked yesterday about the expansion to other laboratories being able to do the tests around the province to decrease the turnaround time for testing. But we're also, each of the health authorities is looking at the best way to facilitate testing for people who need it in each community, and so that will look different in different communities, but there's a lot of innovative things that we're looking at. We have done some drive-by testing, as you've seen from places like Korea, for example, that have been done in some of the communities in assessing people who are close contacts. Public health has gone into homes for people who are close contacts and done testing that way. And the idea that we want to do is making sure that we can test people who don't need medical care outside the home. So people who have mild enough symptoms that they can be tested in the community and that they need the test can be done without having to go to the emergency department. We want to make sure that we maintain our capacity in the emergency department in the hospital sector for those who actually need that type of medical care. We also are, I did want to talk about the fact that we funded 2 important research studies which will help us understand about transmission of this virus in our community. One of them is a serologic study that, although we don't actually have a test yet, we need to start now in understanding what the baseline is, and then once testing becomes available, we can have an assessment of how broadly this virus has been transmitted in our community over time. So it's something that will help us in the future to understand how this virus is being transmitted. The second one is a study that it helps us understand potential impacts. So it's a modeling study, all of which we often say that all models are wrong and some of them are useful, and this will be a study to help us understand transmission in the community, what type of interventions might be more helpful in different areas when the need arises. So that study is being done. Both of these are being led by some of the scientists at the BC Centre for Disease Control. Finally, a lot of questions I've been getting lately are about mass gatherings, small scale, large scale, international, and other mass gatherings. And I want to assure you that we have a process in place for doing an assessment, and a risk assessment we call it, and those documents, if you're interested, are available on the BC CDC and the Public Health Agency of Canada website. And it's a guidance that helps us look at, who's coming, is it indoors, is it outdoors, what are the things that increase the risk, but also what are the things that organizers of mass gatherings can do to help reduce the risk for the participants. And that can be anything from an encouraging and supporting people not to come if they're sick, things like refunds or deferring payments, encouraging people and giving them the ability to clean their hands regularly, to allow space. If things are outdoors, for example, it's much easier, much less risk than indoors. Supporting increased frequency of cleaning in different areas, things like not having communal meals or buffets, but having individual packaged meals. There's a whole host of things that we can do to reduce risks and still allow these important gatherings to happen. So those are things that we're working in the health authorities with organizers around the province, recognizing that the transmission that we have right now is still very low, and most of our risk is really around travel and international travel, including travel to Washington State at this point. So my message to you today is, we are still in a state of very high vigilance. We're watching very carefully what's happening around the world. We know there are things that we can do in our community today that will help all of us protect ourselves, our families, from the transmission of infections. And you've heard me say it over and over again, but cleaning our hands regularly, covering our mouth when we cough, not touching our face and eyes, and most importantly, of course, is staying away from others when we're sick. Even if we do not have this virus, and we don't need to be tested necessarily for this virus, for COVID-19, right now we all need to do our part to stay away from others, to be able to work or do our schooling at home if we're not feeling well, and to protect ourselves and our communities, and to protect those who are most vulnerable in our communities. And we know that that's our elders and our seniors.
Thank you. Just a few words in addition to what Dr. Henry has said today. First of all, as Dr. Henry says, we're at 39 cases. Just to put them in context, 16 of them are linked to travel to Iran, one to Hong Kong or India. That's our case that happily, woman in her 80s who was happily discharged today, one from Washington State. 8 are linked to the Lynn Valley Care Center. Not all those are in or involved in the Lynn Valley Care Center. There are 2 who are family members or close contacts of one of the healthcare workers. 3 from the Grand Princess cruise, which came back February 21st, 1 from Italy, 1 from Germany, and 2 to be determined. 24 are in Vancouver Coastal Health, 14 are in Fraser Health. As Dr. Henry has said, we have dramatically increased the level of testing this week. As you'll see when we release this data on Friday, we've done significantly more testing previous 2 weeks, which themselves represented dramatic uses in testing. We're tests at 5 sites around the province, all the office, the BC Centre. Think about some issues that have in the last few days. First, with respect to the Lynn Valley Care Center, it's clear, and we know this, that there were staffing issues, especially on Saturday and Sunday and into Monday at the Lynn Valley Care Center. Today, there were full complements of staff, both at the morning and the afternoon shift, which just began, I believe, at 3 o'clock. And those issues have been dealt with to the credit of the Lynn Valley Care Center and Vancouver Coastal Health, which has been working hard improve the situation there. In addition, Vancouver Coastal Health assigned communications staff to help communicate with families, to contact each family member in this period, in this 24-hour period, to get full and comprehensive email lists so that updates can happen more regularly, and also concerns can be communicated and we can connect with family members more regularly. A full-time infection control specialist from Vancouver Coastal Health is on site. And so significant actions have been taken today with respect to those concerns. And in terms of the staffing level, the care center is at full complement, and that is to the credit of the care center. If I may say, and I am consistently and continue to be consistently impressed with the quality of news coverage we've received, that I just ask, especially people in the news media, to consider to the maximum extent possible, not bothering people who are their family members going in and out of the care center, or care workers going in and out of the care center. One of the reasons, and there's no reason in community cases to say who or where people are, that we've done that, is both to maintain their privacy and help people get better and help people do the difficult jobs they're doing. And this is not a general criticism or anything else. I would just appeal to members of the media and others to treat the people involved with respect. We have seen significant increase in 811 calls, and there was questions about this yesterday. In a general sense, 811, which is a very popular service, receives about 1,200 calls a week through 811. There are nurses, there's a complement of nurses working on the nurse line component of that. That has peaked this week to 3,800 calls, which is a dramatic increase, more than 3 times the number of calls. And so we are responding by increasing our complement of people. During high call volumes, we average 25 nurses versus 10 to 15 on typical days, but we are increasing our capacity there and opening a new call center so that those calls that come into 811, for example, from members of the public who want advice on risk assessments, those would be diverted, all those that aren't involved with personal health issues, to another phone bank, and that will be in place later this week. Just for those of you who wanted to follow up on the announcement on Friday, the Provincial Emergency Management Coordination Center is underway in British Columbia. The Deputy Ministers Committee that we spoke of, that the Premier appointed last Friday, is meeting now. A lot of work went in to prepare, and so they're reviewing the work that's been done. And over the course of the week, we're going to dramatically increase our communications, not just within healthcare, but within government as well, and our organization in preparation for in implementing at this stage of our plan. And finally, as Dr. Henry has suggested, we're also working, and you'll see this in the coming days, in communities to address the assessment of people who have been referred for testing, to provide the safest possible types of care, and that will be different in different communities, but you will see that in communities around British Columbia. And if I may say, just finally, what we're seeing here is is first of all some positive news, but of course some really challenging news for the families involved. We have 39 cases. We've done enormous amount of testing in BC. We continue to do the most testing of any jurisdiction in the country, and I think that's significant. And the reason we're doing it is because of a strong effort to continue to contain the virus in British Columbia and to slow down the virus in British Columbia. And that's why every case is treated with such seriousness by Dr. Henry and by the entire healthcare team and the health authorities.